Thank you, everybody, for tuning in to the From Trauma to Triumph Summit. I'm so happy to have one of my mentors and colleagues here, Dr. Gabriel Crenshaw, and I'm going to read a little bit about him for those of you who don't know him. And, he's just an expert in psychology. So I'm going to read a little bit about Dr. Gabriel Crenshaw. Thank you, Dr. Gabe, for tuning in and being one of the speakers. You're our consulting expert. As you know, we've been talking about a lot of different traumatic experiences, and there's a whole lot of them that we didn't mention, but let me just read real quick your bio. Doctor of Clinical Psychology, psychologist, published professor, TV and radio personality. I'll put anointed clinician, author, anointed, owner of his digital media show, Mental Minute with Dr. Gabe, which I had the privilege of seeing many times. He is described as America's best life changer while serving a 2-year stint as a psychologist on the TV show Extra. Dr. Gabe is a contributing expert on various news broadcasts. He has appearances on The Doctors, CNN, HLN, Jane Velez Mitchell, The Ricky Lake Show, Jamie Foxx, Foxhole Radio Show. Gabe's expertise is also featured in various print, digital media, international business, Times, USA Today, and on and on and on. And the list goes on. So I'm so honored to have you here. I'm delighted. And I come to pick your brain just a little bit. And so there's 2 questions I want to ask you. The first one would be, first of all, you heard all the themes with the different speakers about dealing with rejection, abandonment, depression, anxiety, just so many, even my own experience, abuse, different forms of abuse. So the question would be to me, of course, we know how some of that affects us, but if you can get into like the brain and the body, a little bit of neuroscience of how traumatic experience really affect us. Some of us talked about the bedwetting and the nightmares and all of that stuff.
Mm-hmm. Mm-hmm. Yeah, absolutely. Here's the deal. It starts all the way in childhood. Traumatic experiences and adverse experiences that happens to all of us to some degree. It's not just a social phenomenon. In other words, it's just this interaction that happens. You hit me, I hurt you, you're traumatized by something, physical abuse, sexual abuse,
yes.
Seeing violence, not necessarily just witnessing violence. All of these things have biological and neuropsychological implications. There's something called the ACEs scores. It deals with, ACEs stands for Adverse Childhood Experiences. Dr. Burke is really carrying this work on right now in San Francisco, dealing with children, because we understand now the adults that we see out here running amok is a result of adverse childhood experiences. And there's something very salient right now in the news. Philando Castile, his girlfriend and their daughter, who was, I believe that's his daughter, in the back seat. I think she was, 4 or 5 years old. Mm-hmm. My heart goes out to her because I know she witnessed the death, essentially the death of her father. This is going to have serious neurobiological, neuropsychological implications. And this is what I mean. We now know for sure that if we give a child an ACEs protocol, and there's a series of questions. How much violence have you seen? Have you ever been exposed to physical violence, sexual assault? Have you witnessed domestic violence? Have you witnessed some sort of physical atrocity? Whatever it is, it's a series of questions. How old were you when it happened? Where were you when it happened, etc. Inside this protocol, what we know is that people who score, for instance, between 6 to 10 are more likely, for instance, it shaves off actually 20 years potentially of their lifespan.
Wow, that's deep.
Why? Because heart disease goes up, hypertension goes up, and these are very real examples. It impacts the neuronal pathways in the brain. What I mean by that is here's our brain, and this is the prefrontal cortex here. Inside of our brain is a series of everything that happens to us starts here in what we call the sensory neuron portion of the brain. So that means everything you think, everything you see, everything you touch, everything you feel, even your intention, all of that starts here.
Wow.
What happens when the assailant gets to you? What happens when the perpetrator knocks on your door, attacks you, assaults you, or you witness it with your eyes? What it does to the neuronal pathways is it alters them. So where you weren't afraid before, you now are. So now all of a sudden you are in hyper arousal mode. What does this mean? This means that some of our kids, they're experiencing what seems to be ADHD. Well, perhaps it's not ADHD at all. It could be PTSD, or even more so complex PTSD, which is severe impact of a series of atrocities that they've witnessed. You don't have to be the victim. You actually see and watch the victim and experience it away, but still close enough to hear and see and have a feeling and the impact of what just happened in this violent, aggressive situation, which is exactly what has happened to this 4-year-old kid sitting in the backseat of that car watching Yanez.
Wow.
It's murder. I believe it was murder. Philando Castile.